It is my great pleasure to welcome our neighbors and our friends to this public forum on human rights and mental health. And I'm going to give you an overview of what the forum is going to be all about. We are today here to celebrate International Human Rights Day, and we are going to do that by being proactive and have a conversation with our community so that we can be empowered and help others in the community that perhaps were unable to be here with us today. And with that, we're going to begin by learning more about the issue. Let's start by inviting Virginia Beach Human Rights Commissioner Teresa Stanley and Caitlin Mondehar to the podium. And Teresa Stanley is a member of the Human Rights Commission. Caitlin Mondehar is the Population Health Manager with Virginia Beach Public Health Department. Thank you, ladies.
Thank you, Beatrice. I'm really, really pleased to see people here this evening because this is such a critical issue. Virginia is still pursuing the promise of mental health made 56 years ago in 1963 when President Kennedy signed into law the Community Mental Health Act that promised to drastically transform the delivery of mental health services. No longer would people be warehoused in institutions. They would return to their home communities and families where they would receive needed treatment and services. Deinstitutionalization came about rapidly. By the year 2000, there were less than 10% of the number of institutionalized facilities that were there 50 years before. Virginia's public mental health system consists of 40 community services boards, providing services across the Commonwealth, and 9 mental health hospitals. Sounds pretty good, and Virginia can boast about being the first state to establish a public mental health hospital in the nation. There have been many champions for mental health in our state, to include Senator Creed Deeds, who suffered a great personal health tragedy in November of 2013 with the loss of his son. Since then, Senator Deeds has tirelessly led a bipartisan effort to improve mental health services, resulting in the passage of the crown jewel of those efforts in an initiative known as STEP Virginia. You're going to hear more about STEP Virginia from NAMI Advocacy Chair Max Willey later in the program. STEP Virginia consists of 9 core services that have been proven to be the best practices for delivering essential mental health services in our communities. Though STEP Virginia was passed, Virginia has not yet met the promise to fully fund it. The 2020 State of Mental Health Report showed Virginia's overall ranking has improved to 27 in the nation, but adult rankings have declined, the worst in 5 years, down to 43rd. Access to continued care ranks at 37 among all states. The suicide rate in Virginia is rising each year, as well as the jail population of inmates with mental health conditions, which is now at 17%. Some of the outcomes of an inadequate mental health service system are frequent visits to emergency rooms, homelessness, suicide, incarceration, and substance abuse. And now Caitlin will provide us with some local statistics.
Hi. So every 3 years, the health department conducts a collaborative community health assessment process. And really the purpose of that is to give us a relevant and meaningful picture of what does the current landscape of health look like in the city of Virginia Beach? What are any health inequities we can identify? What are the current state of the social determinants of health? And this is also used as a tool to help our population health planning efforts. It's used to inform stakeholders in determining what public health challenges to tackle as a part of our community health improvement plan. And mental health continues to rise as the top as a priority health issue to focus on. So while there isn't enough time to highlight all of the data, the full report is actually available on our website. I do just want to highlight a couple key statistics with you all. So Virginia Beach residents reported higher diagnosis rates of depression and anxiety than the rest of the Hampton Roads region. So looking at all of the cities nearby, Virginia Beach has higher rates. So the rates of hospitalization due to suicide and intentional self-inflicted injury, as well as the hospitalization rate due to mental illness, is noticeably higher in Virginia Beach when compared to the state of Virginia. As well, some 10,500 teens, Virginia Beach teens, reported feeling sad or hopeless. Mental health provider availability continues to be a concern for Virginia Beach. The city is only at 67% of the national average of availability in the United States. Virginia Beach has seen an increase in death rates due to drug poisoning and prescription opioid overdose. 28,000 or more adult residents in Virginia Beach are using prescription drugs that are not prescribed to them. So those are just a couple of the statistics, and again, the full report is available on our website.
So as Beatrice has already stated this evening, we just want to reemphasize, why are we here? We've come together to learn tonight more about how the impact of stigma and lack of access to mental health services are a violation of human rights. We've come to learn from our esteemed panel this evening about resources in our community that we can partner with to assist in efforts to offer our care. And we've come to increase our understanding and awareness that people with mental health conditions are our family members, friends, and neighbors who deserve to live to their fullest potential. They've endured the trauma and suffering of living with a mental health condition, the feelings of shame and isolation brought on by stigma, and they deserve a system of care that addresses their needs and helps them live productive lives in their own communities. And if our hearts are moved enough, we may be willing to be called to action this evening by starting with a simple step of calling our own senator and delegate to ask that they support full funding for STEP Virginia so that we can finally keep the promise that was made more than 56 years ago. We can't wait for you to visit us outside at the advocacy table while you're eating the delicious food during the networking part of the forum this evening. So thank you.
Thank you. Thank you, Teresa and Caitlin. And now it is time to introduce our keynote speaker, Janet Roach. Janet Roach is a 7-time Emmy Award-winning journalist and a 2-time recipient of the Edward R. Murrow Award. We invite our community to join her Monday through Friday as she co-anchors 13 News Now at 4, 13 News Now at 5, and 13 News Now at 6. Janet has been covering national headlines throughout her television career, from the terror attacks on 9/11 to the commemoration of the landing of the first enslaved Africans in English North America in 1619. This year, her documentary 20 and Odd Africans' Arrival in 1619 won a regional Emmy Award. Janet is a big believer in looking out for our community. She spends much time talking to women and children's groups. She enjoys serving as mentor to aspiring journalists and her younger colleagues who are new to the industry. Janet is a graduate of the University of North Carolina with a BA in Public Policy Analysis, and she is a Tar Heel. Janet was inducted into the Order of the Golden Fleece, which is the oldest and highest honorary society at the university. She also won the annual Martin Luther King Scholarship, given to one student annually for his or her commitment to the improvement of the quality of life on campus. But being a mom is Janet's proudest achievement. She has 2 teens, Gabrielle and Trevor, and she lives with them and her husband, Harold, in Newport News. So please, ladies and gentlemen, help me welcome Janet to the podium. Thank you, Janet.
Oh, thank you. What a nice introduction. I appreciate that. And yes, go Heels. I'm a little concerned about the basketball team this year, but I'll get over it. Okay. I want to thank you for inviting me to be able to show a couple of clips from the documentary that just aired this past Sunday, Looking for Happiness. Every time I take on one of these projects, like I took on the 1619 last year, you work so hard on it, and then in the end, you can think of 5,000 things that you wish you could have gotten into the documentary. You only have but so much time. But I felt like it was a very important topic to tackle. Obviously, as you all know, mental health is something that we're starting to hear much, much more about. I'm not a mental health expert, I'm far from it, but as a journalist over the years, as I cover stories, those are two words that come up very often, again and again and again, mental health. They come up in crime stories, as you would imagine. They come up in school bullying stories. I've been scammed stories, and yes, political stories as well. So when I decided that I wanted to do this, it started with a phone call I got from a friend. And she told me, you know, I have a friend and she's been through a lot with her son. He's mentally ill and he's missing. And so since I work at the TV station, she thought, you know, is there any way you can get something on television about him being missing? And so I said, well, give me a description, give me the information, tell me what you can about this person. And she did, but fortunately, a short time after that, maybe 30 minutes later, he was found. Well, he was at the oceanfront and he almost drowned. Somehow he ended up in the water, doesn't really know how to swim. And but he survived and he made it through. So that's when I first heard about this woman, Sherita Martin. And initially, I didn't call her, I didn't do anything about it. But sometime later, I decided that, out of the blue, I decided to call her. And as you will see, the first thing I noticed is that she was desperate for someone to hear her story. And I didn't really know whether or not she had done everything right, whether she had asked all the right questions, whether she ignored people who could have helped her, or whether she didn't ignore people who could have helped she and her adult son, Tony. I didn't know, but I tell you what I did know. I knew that there was a problem. I knew that she was desperately fighting. And as a mother, I can identify with that feeling of being an advocate for your child. And those are stories a lot of times that draw me in. I can identify because I know what it's like to fight for your kids. I remember my mother fighting for her children. And even my son, when I noticed something was not right with him, with his reading, and I did all this research and I figured out he has dyslexia, only to find out that very little is known about that in the public school system. So I did more research until I could get him the right remediation that he needs in order to be able to read well. And then at the same time, around the same time, I'm watching him, I'm like, something else isn't right. And then he comes down with type 1 diabetes. For some reason, out of the blue, his pancreas decides it's not going to produce insulin anymore. And I had figured it out, then took him to the doctor. He ended up in the hospital, and sure enough, they confirmed that he had type 1. And that's not including the peanut allergy as well as the ADHD that he has. So I understand what it means to advocate and try to get people to understand. So the first clip that I will show you is a little bit of Sherita Martin and her, well, I don't know, this is clip 2. Are we going to do clip 2 first?
Yeah, we're going to do
This one? Okay. Looking for Happiness is the name. Also, what I had an opportunity to do as I explored this topic, went to Virginia Beach. My understanding is Virginia Beach is a little ahead of the game in terms of fighting for mental health. I was one of the first. Okay, okay, there's the first clip, but I'll tell you about the second one too. We can just run them back to back. So I wanted to know about the crisis intervention training in CIT. So I met Sergeant Gordon, who's over there. I had an opportunity to talk with him. He told me about how they have the co-responder teams. I believe it was November of last year when they launched that. And that's when a CIT officer can actually travel with a mental health clinician that comes from the Community Services Board, Emergency Services, and they travel together. So whenever there's a call, if somebody is trying to commit suicide or any type of crises, there's a clinician right there on the spot traveling with the officer so that they can do that assessment right there on the spot. And one of the things that Sergeant Gordon told me is that he has the opportunity to train not just Virginia Beach officers, but a lot of other jurisdictions and agencies across the area. They come to Virginia Beach for that training. And I believe so far this year, you've had more than 2,600 calls and something like 7,200 man hours. And just watching the way the officer and the clinician interact with this one person that is in the story, it's just very thoughtful. You know, you can tell that there is training there. You can tell that there is care. So we were happy to be able to include that as well. And then I met the Urosky family. They're from Virginia Beach. And I got a chance to hear about their story. They have 4 kids, and their oldest child is Alexa, and she's 23. And it was just one of those situations where the mother goes to pick her up from college. She's in 10th grade. I mean, she's a sophomore. She goes to pick her up from college during for summer or Christmas break, and she noticed that something wasn't right. She noticed something is going on with my child. And let me tell you, there is nothing like the eagle eye of a mom. She can notice something from a mile away when something is wrong with her child. So that was the beginning of their journey in mental health. She had a psychotic break that Christmas, and she ended up in a psychiatric hospital. She ended up in the hospital 2 more times after that. She's doing really, really well now. She's very passionate about mental health, and she has started her own support group, and she's helping others. So let's take a look at just a little bit of Sherita, and then we'll go to the second clip. When I met Sherita, one of the first things I noticed is that she was desperate for someone to listen to her story.
I have stuff ever since he was a baby, his diagnosis, tests, and things like that. Schizophrenia, schizoaffective psychosis, mood disorder, depression, all kinds of things.
Asperger's syndrome, so he's on the autism spectrum. We got to know her and this struggle that she's been on to get him adequate care. You'll find her just poring over paperwork, medical records, documents, emails that she's written.
My name is Sherita Martin. I am writing this letter to get help for my son. Dear Governor Northam,
You can hear the determination.
I will do my best to keep the passion I feel in fighting this fight out of this letter.
In every single word that she says.
I feel like it's Tony and I against the world because it's just hard to get help and everything I have to do. If I don't do it, it wouldn't get done.
I think the system has let her down because she sees that her son is suffering from a multitude of issues and no one's really able to give a definitive diagnosis or a reasonable treatment plan.
Medication for anxiety, medication for the ADD, so many medications he's been on.
Mom feels that he's had some negative effects from some of the medication that he's taking, and you can't rule that out. Everybody's different. People have very negative reactions to some of the psychotropic medication. So, I mean, she's not coming out of left field.
We wanted to know how CIT officers work.
Okay, dookie.
So we went to Virginia Beach.
We recognize this as a growing issue that we're responding to more and more calls for service that are CIT related.
Car 90 to 428.
A clinician is paired with an officer, so as soon as that call comes in, they start heading to that location.
Once you find her and you think you might need my services, I'm not going to be too far away with the clinician. Feels suicidal due to not feeling like he is good enough.
When the co-responder team arrives, the clinician will then start that assessment
like
process
this for
with them
months.
in the field.
Should be it, right?
Yes.
Army baseball cap, blue shirt, khaki pants, yeah.
Car car 90, we're on scene.
They're looking for 3 very specific things.
If they're homicidal, if they're suicidal, or if they have the inability to care for themselves.
Hey, I'm Officer Brick. This is David. He rides with me. He's a mental health clinician. So we just want to see what's going on with you and how we can help you today.
I want to go to a mental hospital.
Okay, you've been feeling bad for a while, you said?
Yeah, and I was cutting myself.
Oh, yeah, I see that.
Our emergency services clinicians are highly trained. They are certified by the Department of Behavioral Health and Developmental Services, and they're aware of how much patience they need to have when they're on these calls.
Have you been to a mental health treatment facility before? No? Okay.
We're trying to figure out what their current status is. Do they know who they are? Are they aware of their situation?
Did you have an overdose attempt? Is that right?
Yeah.
Okay, and that was, when did that occur?
On Friday.
On Friday? Okay.
And then if they meet criteria, that's when the bed search comes in.
And that's an issue because we see a shortage of beds.
A clinical reason why I would put someone in the hospital would be really, I want to take care of their illness, right? I want to take care of their schizophrenia, their bipolar, their major depression, whatever it is that they're troubled by, I want to take care of that diagnosis, okay? And treat that patient, okay? The only thing the government, the law cares about is, are they a danger to the community or they're not able to care for themselves? And so, it's police powers versus parent powers.
Long hospital stays are a thing of the past.
And even my early private practice days, well, we could keep people in the psych unit, a fairly long time until their illness is truly healed, truly treated. So like a patient with schizophrenia, a patient with bipolar, we could treat them for 14 days, 3 weeks, as long as it takes to get them better. You don't get that gift anymore.
That first hospital stay, was so traumatic for all of us because, first of all, we had no idea what was going on. We didn't understand anything.
The Hirosky family, they live in Virginia Beach. Teddy and Susanna, 2 of their 4 children, Luke and Alexa.
Our oldest was a second year in college. She had just finished her exams, and I went to pick her up.
And immediately, her mother notices something is wrong.
Things were just bizarre when I picked her up, but I didn't understand it. I didn't know what it was.
In retrospect, I'm like, yeah, something was off. Like, I never slowed down. I didn't even need to sleep, which was crazy.
And that turned into her first psychotic break and an admission to the hospital.
Obviously, now I have a diagnosis. It was mania at the time. And mania is just like this euphoric high. And, you don't get it from drugs or anything. It's literally just your brain is just kind of going haywire.
If we thought the first hospitalization was traumatic, those second and third ones were really terrible.
Each time it got worse.
Her behavior was getting more and more bizarre. And then we had gotten a call from the police, and she had been on Virginia Beach Boulevard, but near a motel, but in the middle of the night digging through the dumpsters that God was telling her to recycle. There were times that my husband would come home and then Alexa thought my husband was the devil.
I remember I thought I was a fairy. I thought there was the devil inside the house. So if I opened up all the windows and just did this thingy, they would all go away.
She thought trees were bending.
And the fact that our Christmas Day was going to a psychiatric hospital, it was life-changing.
So those are 2, I think that totals up to about 7 minutes. So the complete documentary is about 28 minutes, a little bit over 28 minutes, and it is on 13newsnow.com. And also, we included, extended interviews. So if you go online, you'll also see more from Angela Hicks, who's with the Community Services Board. You will see Courtney Boone from NAMI. There's several comments from her as well. Cree Deeds, Jennifer Brown from Seaside Behavioral Health, and a couple of other interviews, more with Sherita and more with the Uroskis. So one thing that I have discovered after doing all this is that, you know how sometimes you get into something and the more you discover, the more that there is to do. The more you do, the more you need to do. So I am open to ideas. I heard one just from listening to you all speak about the fact that Virginia Beach has those higher numbers. And we hope to be doing some follow-ups and have a good discussion here this evening. Thank you.
Thank you so very much, Janet, for bringing to our attention issues of great importance to our community. And now it is my time to introduce our panelists. And as I call your name, I'm going to ask you if you can please come and sit in the seats that we have here for you. And then I will introduce you individually, each one of you. And then from the place where you're sitting, we ask that you make your presentation. And meanwhile, while we have the community sitting there, start thinking of the questions that you want our panelists to share with us. This is a great opportunity. We have two people that are volunteering in the audience. Can you raise your hand? Right there, you can turn to the back. And they're going to be passing cards, pens, or pencils if you want to use those resources. And please, don't be shy. We need your questions, and this is a conversation. So we invite you to participate. And I am going to ask Sergeant James Gordon from the Police Department Crisis Intervention Program to come in. And Annette Miller, Senior Trial Attorney from the Virginia Beach Public Defender's Office. Natasha Sams, Virginia Beach Department of Human Services Behavioral Health Division. And Courtney Boone, President of the National Alliance of Mental Health Illnesses of Coastal Virginia, better known as NAMI. And now let me introduce to you first, after they sit down, you're going to be comfortable. We want the audience also to feel comfortable as we are having this important conversation. And I'm going to ask Sergeant Gordon, James Gordon, to be the first person to speak. And let me tell you a little bit about Sergeant James Gordon from the Crisis Intervention Team, Virginia Beach Police Department. Sergeant Gordon has over 18 years in law enforcement and obtained his associate degree in criminal justice and his bachelor's degree in business administration from Ashworth College. He has worked as a correctional officer with Hampton Roads Regional Jail, and while with the Virginia Beach Police Department, he has worked as a patrol officer, community policing officer, property crimes detective, a special investigative detective, patrol sergeant. You did it all. Deputy Chief of Operations. Sergeant Gordon currently oversees the Crisis Intervention Program for the Police Department and is a general instructor and a CIT Corps instructor. Sergeant James Gordon, please. Thank you.
So for the Virginia Beach Police Department and our involvement in mental health in our response, we get dispatched to pretty much any and all calls for service in which you all call in as citizens. We go, we get the call, we go. As Janet covered some of the data from 2019, and that data isn't complete yet, obviously, because we're still in the year. But over 7% of our calls involve mental health calls for service, whether it's suicide, calls for service, or just mental health crises that are occurring. So officers respond, and we interact with these individuals. So last year we spent over 9,000 hours in 2018 on mental health related calls for service. We developed a CIT program in 2008. We partnered with the private hospital of Virginia Beach Psych in 2010 to develop our assessment center, which is an area in which that we're able to transition the individuals that are in crisis to individuals that are trained while they're awaiting the whole process of being the bed search and trying to find the location for them. We always try to evolve our program as we grow, as mental health is growing. We try to stay on top of the game, as Janet alluded to earlier. 2017, we implemented a supplemental staffing unit just for CIT-related calls for service, which is an overtime unit that is established. It was such a high precedence for the chief that we were able to establish this, that their sole job is to respond to any and all CIT call-related services during their time frame of working. And they're all CIT certified, so we're putting the right people on the right cases in hopes that when we engage with individuals that are in crisis, we are able to de-escalate the situation and get them to the right services. In 2018, as she alluded to, in November of last year, so we're just over a year into our MCRT, which is our co-responder team, where we have the officer and the clinician riding together. We responded to over 667 calls, just that unit alone, that are mental health related. And the important thing to highlight on that is over those, 96 of those turned into ECOs, which is emergency custody orders, is taking them into custody to get the mental health treatment that they need. But the rest of them were diverted into outside patient services or voluntarily services and trying to get them to the right treatment that's needed. So our efforts are ongoing. We're continuing to grow. We're hoping to evolve into our social navigator coming up soon, which would be a follow-up involving peers and the community service board or the emergency services board. And just to follow up after the crisis is over, just to say, hey, are you okay? Let's get you into these programs and continue the treatment that's needed for the individuals.
Thank you very much, Sergeant. And our next speaker is Annette Miller, senior trial attorney. She graduated from Virginia Tech in 1983 with a double major in English and political science from Syracuse University, in 1985 with a master's in English, and from the University of Richmond in 1988 with a degree in law. She was the first law clerk in the Virginia Beach Circuit Court from 1989 to 1991. She started employment part-time with the Virginia Beach Public Defender's Office in 1995, and she has specialized for approximately the last 17 years in criminal law with an emphasis in forensic psychology and insanity litigation. She has been published in the American Bar Association, Criminal Litigation, Winter 2010, Volume 10, Number 2, for the article Post-Adjudication, Not Guilty by Reason of Insanity. This is a process in the state of Virginia. She received the Virginia Beach Human Rights Award for Mental Health Education and Advocacy in the year 2000. She has consulted with courts, the jail, police, public defenders, and private counsel on a variety of legal mental health issues. Annette, thank you.
Now, unfortunately, when you hear when I graduate, it sort of dates me and lets you know just
Can
how...
everybody hear? We need to raise if you don't mind, if you feel that can help, use one of our microphones.
Can you hear me now, guys?
Can we raise the volume? Thank
How
you so
about
very
now?
much.
Now? Okay. All right, so you can tell from the year I graduated, it sort of tells you how old I am and how long I've been doing this at this point. But in any event, I get the cases when diversion fails, when they don't get to just go to the hospital, when charges have been taken out. And sometimes, excuse me, it's parents that take out charges because they don't know what else to do. They don't have any other access to services. Sometimes they don't know how to access the services that are around. So education has always been an important part of everything. And when I get them, I've seen it throughout the years where initially when I first started, someone could be hospitalized and stay, or not hospitalized rather, but be in the jail for a year before they ever got out of the jail just to go to the hospital. And when their charge carried only 6 months to serve, it was horrendous, particularly if they were doing very, very poorly in the jail. And over the years, I've seen that change to where with creeds and the rules that have come out since then, and the changes in the law, that from start to finish, once a person is deemed to be incompetent, they end up in the hospital within 7 to 10 days. And so instead of spending a year in the jail, they now spend somewhere under 30 days from the point we get them to they're evaluated to they're on the list, and they then go ahead and get directly up to the hospital. A couple of programs have started in Virginia Beach to try to make sure no one is forgotten or left behind. And part of those programs involve with the General District Court, excuse me, is a General District Court mental health docketing system, so that once a person is designed or designated rather to be mentally ill, then they then go ahead and get on a list, they get evaluated, and if they're deemed incompetent, they get on a restoration order very, very quickly. As to the circuit court, there's a mental health program to make sure once a person leaves the jail, they go directly from the jail to the Department of Human Services to go ahead and get medication and make sure all those components are followed through and that medication's available. That's always been one of the main problems, is once I get a client on their medication, it's keeping them on the medication so I don't get them back. And now recently, we're just starting, the Commonwealth Attorney's Office has been very proactive with it, and it's very seldom that I'll give them a compliment on this, but being the other side, but they are very, very proactive right now in trying to start a mental health court that will be in the circuit court, and that's only just right now in the very infant stages of it, but we're looking at getting that started as well. Because one of the things we all realize is once I get a person, it's trying to get them not having any form of conviction. But if they have a conviction, it's to get them on their medication, stay on their medication, have access to services, have housing, and that's the greatest success I can get, is when someone then gets out and then doesn't come back.
Thank you very much. And it is the turn now for Natasha Asam, MPA, Behavioral Health Division. Natasha Asam's MPA has spent the past 25 years in the behavioral health field, including direct service provision and program administration and development, with a specialty in residential and in-home support. She currently serves as the Supportive Residential Services Program Supervisor for the Virginia Beach Department of Human Services Behavioral Health Division. Supportive Residential Services provides a continuum of supportive and supervised residential housing and service options. During her 14 years of tenure in this role, she has developed a variety of housing options to include adult foster care, co-occurring transitional housing programs, and evidence-based housing first, permanent supportive housing options. Help me welcome Natasha Asam.
Thank you. Well, I think I've just dated myself too with the 25, so. I work for the Department of Human Services with the City of Virginia Beach, and as the Beatrice said, we primarily work on housing options for the adult population of individuals with complex clinical conditions, which include mental health diagnoses and co-occurring disorders. We have approximately 185 slots of housing, and there's a continuum of supervised housing and supportive housing to include independent housing. Some examples of some of the housing options that we have are adult foster care homes. These are designed to provide 24-hour supervised care in home-like environments for up to 3 individuals, and they provide 24-hour care, provide medication administration services, provide meals, prompting in activities of daily living skills, and typically individuals that go into adult foster care homes are individuals who've tried to reside in more independent settings, but just need a little more support, or are stepping down from state institutions or jails and need supervision for short term until we can support them with skill acquisition to move forward in more independent housing options. Our biggest and newest program that we're super excited about is our permanent supportive housing program. We have the capacity to serve approximately 72 individuals. That combines support services and financial subsidies in the community. It is a housing first model, so we have low barrier admission. That means that we don't look at credit, we don't look at criminal histories. We try to remove barriers in terms of treatment readiness. We meet individuals with where they're at. So if they're not still working on their sobriety and they are not at 100% sober, or they're not ready for a full array of mental health treatment, we still house them because we believe that housing is fundamental to individuals being successful with their recovery. Once we house them, we have actually workers that actually go out with them, help them find an apartment in the community. And then once they identify an apartment where a landlord will accept them, we provide the financial subsidy to support them in that apartment, as well as housing staff that support them with ensuring that they pay their rent on time, ensure that they're identifying their needs, and linking them to traditional mental health support services or treatment in the community. That has been very successful. We ensure that we support them with education around reasonable accommodation, fair housing rules, and that's it. We have a variety of other supportive housing services where we provide mental health skill building services. But again, we have approximately 185 slots of housing within the city of Virginia Beach.
Thank you. Courtney Boone, President, National Alliance of Mental Health Illness, is our next speaker. Courtney Boone is a member of NAMI Coastal Virginia Board of Directors and currently serves as president. She has previously held a variety of roles as a board member and helped the affiliate grow beyond Virginia Beach to encompass Norfolk, Chesapeake, Portsmouth, and the Eastern Shore. Courtney's area of expertise is developing and improving relationships, processes, and policies for the affiliate and its leadership. She is dedicated to continuing the growth and visibility of NAMI Coastal Virginia in order to meet the needs of those living with mental illness, their families, and the community at large. Areas of specific interest for Courtney are widespread education regarding early onset, early identification, and early intervention, parity in all mental health services, the criminal justice system, and education support and advocacy for veterans and their families. Help me welcome Courtney Boone. Thank you.
Thanks for having me. So just a little bit about NAMI, and I don't know how many of you, I think quite a few of you have probably heard of the National Alliance on Mental Illness, but we are the largest grassroots organization in the United States as it pertains to mental health. When I first started, I was a little confused about exactly what we did, so I put it into 3 buckets, which I'll give to all of you very quickly. We offer support to the community. That is support in classes, that is support from our volunteers. The second bucket is education. We offer education classes, and both the support and education are not only for those living with mental illness, but also their family, their loved ones, their friends to access. And you heard free. All of those are free that we offer to the community. And then the third bucket, and one that really impacted on the human rights front, is our advocacy and our outreach. We have several different programs that we're able to offer, not only to the community, but to some very important community partners that we have. One of the number one things that we do, that we find we do, that Mrs. Jen Williams, who is the director of our affiliate, is navigating this mental health landscape, navigating the judicial and the legal landscape, navigating all the different aspects when you or your loved one becomes ill. Because unlike any other therapeutic area where you're given all the information and everything you need at the onset of your illness, that absolutely does not happen when you have mental illness. And for that, NAMI is here, and we work tirelessly, and the volunteers in our affiliate are so extraordinarily passionate to making sure that that does happen and that every single community member knows that we exist. So they can either share that with someone who needs it, when they need it, or use the services and the things that we have to offer. There was something that NAMI National put out, because that third bucket in advocacy and outreach, that advocacy is done through on a national level, on a state level, and then also at a local level. And with that, it was that every individual living with mental illness has the right to be informed of all community services and resources available. And for that, we live and we work for that human right every single day.
Thank you very much. And now it is our turn. It is the community's turn to begin the conversation with questions. Please raise your hand if you have a question that somebody can come and pick them up. And thank you very much. And while we begin that, let me ask all of you to address the following. The Human Rights Commission, the Virginia Beach Human Rights Commission, is concerned about the fear of discrimination that people with borderline mental health issues may have in approaching or seeking help. Can you think of other human rights issues that may be of concern to the community so that we can be proactive in our approach of making things better in our community? Anybody that wants to begin? Thank you.
Not having them trapped in a jail setting because they have mental illness. And that's the main thing, is to get them out and to get them back in the community as quickly as possible and get them linked to services. Because a lot of them, unfortunately, don't want to acknowledge that they are mentally ill. And so the part that we try to help with is to get them to understand their mental illness, get them to appreciate being on their medication, but more than anything, getting the courts to appreciate it and getting them to go ahead and be linked to services and get out as quickly as possible. Because the longer they stay in, they're staying in only because they're mentally ill. Because typically I can get someone out quicker on a bond that is not mentally ill because I can have a judge trust more that they'll do what they're willing or should be able to do when they get out on bond. But those that are exhibiting severe mental health issues, I have to then get the judge to appreciate they're well enough to get out before they're going to let them out. And it's not because they don't want to see them get out. It's because they're afraid they'd be a danger to themselves or others or the community. And so they try to have more of a caretaking role. And so to some levels, although I understand it, it's somewhat unfair. So trying to get it done as quickly as possible and get them out as quickly as possible.
Thank you. And the next question, because we have plenty of questions here, so let me go one at a time. And I do appreciate if you share the microphone so that we can have different perspectives. Why does Virginia Beach have more mental health problems? And I heard that actually Virginia Beach has a lot more resources than other communities at large, but somebody wants to know why.
I'd just like to take a shot at this. They don't have any more problems than any other community. I really do think, I was talking about our important community partners, and one of those is the jails that we work with, and specifically we work very closely with Virginia Beach Jail and have some programming that actually just started there. But as well, we've started working with the Hampton Roads Regional Jail because our affiliate has grown to encompass where those individuals are housed. It is a pervasive issue that is not singular to Virginia Beach. These issues are happening everywhere, and we're having a significant issue in communicating. And someone said earlier this evening, there are a lot of hands, but none of them are shaking. And that's what I find when I am dealing with the correction system, that they are trying desperately with such limited resources to do the right thing and to make changes. And those partners, those other hands on the other side, aren't shaking back. And that, I hope, helps.
Thank you. And this is a question for Sergeant Gordon and Annette. How does your work help?
Jenna got a response.
I just wanted to.
Yes, please. Yes, go ahead. I cannot see from here, so raise your hand, Janet,
probably
if you have the
can't
mic.
see me.
Thank you. Thank you.
I was just going to ask, are there any figures on a typical jail? How many people are suffering from mental illness in the jails? Or is there a percentage on that? I've heard it's pretty high.
I think Sheriff Story keeps a record of it.
Okay.
And I think she knew.
Virginia Beach is the second largest mental health provider in the state. So that number, 7% that you gave earlier, I'm not sure how you all are defining those numbers, because mental health is so much more than someone who is just acting erratic.
Right.
So
Mm-hmm.
I'm curious.
So the 7% are not arrests. They're not people in the jail. 7% is just the percentage of calls for service that police respond to that are mental health related. That in no way, shape, or form is to reflect the amount of the inmate population that are living with mental illness. That's just the police response to calls for service that are identified as mental health related.
Get a large percentage of those who are sitting in Virginia Beach jail and other jails that are in Virginia, they have some type of mental health issue. And I know that you spoke of resources that are available to them as they're getting out of prison, but the facts are they're being released out of jail with 3 days worth of medication. It takes most mental health patients 60 to 90 days just to see if that medication is working for them, and sometimes even longer.
Thank you so much. Let me ask this question to Sergeant Gordon and Annette. Somebody wants to know, how does your work help protect individuals' human rights?
You first.
So as it pertains to the mental health human rights, obviously when the police get involved and we get called, it's normally when they're in crisis, when an individual is in crisis. If they're voluntarily seeking services, we get a couple of those calls as well, but the majority of the time when police have to stay involved is when the individual goes into a full-on crisis. At that point, we're guided by the codes of kind of what we're able to do and what we're not able to do. As we learn in our CIT class, we try to divert from the criminal justice system if at all possible, understanding that a lot of people have a misconception of the criminal justice system and that if they're in there, they get treatment. The jails do the best that they can with what they have, but they cannot force medication, which is misunderstood from a lot of folks. So we recognize that. So we want to try to get them to the services that they want within the allotted times that are provided. We struggle at times with the system that's in place. We're restricted by code to hold them for 8 hours on an ECO, and then as a TDO, we have 24 hours to serve that. So there's a lot of things that we are restricted by law to do, and we see the delay in the services, the delay in getting them to the mental health treatment facility. And that's not on the police's delay, that's on the delay of the accepting facility, things like medical clearance, which has become more and more prevalent in all of these CIT-related calls for service. And then when there's issues with that medical clearance, it's a doc-to-doc conversation. That's completely out of the hands of us as police, but we are there, we are waiting, we are wanting to transport them to the mental health facility so they can begin receiving the mental health services that they need. But we're really at the mercy of the system itself. And sometimes we can see how those delays impact the individuals that are in crisis, that live with mental illness, because as the crisis is going on, as you can imagine, they want help at times, and they start to escalate because they're not getting that help that they need. So we're kind of stuck in the middle, and we try to do the best that we can in keeping them calm, and our CIT program has been instrumental in the ability to do that.
Thank you very much. And I'm gonna concentrate on the cards. I wanna thank the community because there are a lot of questions here that we need to address, so the conversation has to be a lengthy one. Fortunately, I want to tell you that we're going to have a reception at the end, and the speakers are going to be here for you to kind of approach them, if you don't mind. Will peer recovery specialists be a part of the CIT in the future? And the other question is, wouldn't it be useful to have a central address to navigate and coordinate mental health issues?
Absolutely. So the short answer is yes. Obviously, with our next step of wanting to move into a form of social navigator, is that outreach after the crisis has occurred, is to absolutely bring peer specialists on, bring them on to kind of guide and help guide these individuals through the process to recovery. We would love to meet more and more when individuals are not in crisis. We want to try to prevent them from going into crisis. And the one-stop shop, the one central location, is the ideal thing to do. That is something that we would advocate for. There's other parts of the country that have that. Arizona has one called No Wrong Door. It's one place where you go, and whatever your issues are, there's services there. We're making steps and strides in that direction. Our vision is to get there. Obviously, there's some issues legislative-wise and trying to bring everybody together for the common goal. But we absolutely support that. We think it's extremely beneficial for the individual that's in crisis, and even those that aren't in crisis, even those that live with mental illness that need to go to a location so they can get services, enroll in programs, instead of being diverted all over to different areas, just to have one location to say, this is where I need to go, and I can get the treatment and services that I need.
And Annette, yes.
He took that question.
Oh, okay, so then let's move forward.
He answered it quite
He took
well.
the two of them, all right. Why do we have to wait 2 to 3 months for appointments or 6 months for ECT? Why can't we attract more professionals?
There is a shortage of mental health professionals in the entire country, but particularly in the Hampton Roads area, we are absolutely in desperate straits. One of those reasons is the pay and what's offered. The saving grace to mental health, in a lot of people's opinion, are nurse practitioners and physician assistants that have the psychiatric specialty. Because they've really helped to fill a gap. But it takes so long, and we do this a lot in helping navigate, because a lot of the providers that are out there will neither not take your insurance or they're not accepting new patients. And I could give you a list, any of us, a list of 50 mental health, or 50 psychiatrists in the Virginia Beach area. And I can guarantee that out of that 50, you might get an appointment in a fairly reasonable time with 2 out of the 50.
Thank Thank you. And the community health assessment showed more depression and anxiety in Virginia Beach than in the Hampton Roads area as a whole. Why do you think this is? And this question is for Natasha and Courtney. How do your programs help protect human rights?
I think you can't enjoy full freedom of any human right without a place to lay your head. And I think that's what we focus on, is providing safe, affordable, and housing that's integrated in the community. And I think that's where we support human rights, is to give individuals the basic necessities so that they can focus on their physical, emotional health. And I think housing is paramount to that. I would like to say, though, that we are really encouraging people to think about and consider being more receptive to the idea of individuals with mental health conditions living in the same communities that we do. We oftentimes have difficulty identifying communities that are willing to be open to individuals who have serious mental illness and some of the behaviors and symptoms that are related to those illnesses. So we just ask people to be open to understanding that everybody needs an affordable and safe place to go where they can engage in their basic human rights, to work, to be with their families, and the same freedoms that we enjoy.
And this question is for Nami. Thank you. How long, this is for the short term, what is the timing and how long does it take before NAMI responds to a call via internet request?
Okay, so that's a really good question. We used to be NAMI Virginia Beach. In January of this year, we became NAMI Coastal Virginia, overseeing, as mentioned, quite a few communities. We're all volunteer. So up until middle or end of last year, we had one volunteer who came in for 2 hours on Monday to the office to answer the phone. We have a rollover that would work in emergency situations, but other than that, we weren't extraordinarily responsible because an affiliate, an organization like this, Grassroots, is only as good as their volunteers. I think to date, and I could be misspeaking, but I don't think so, the office is staffed 5 days out of the week. But if someone is sick, we don't have someone to come backfill and answer the call. The email, we probably receive around 70 emails a day, and that's usually one person triaging that. And I know for a fact that one of those emails could take up to 2 to 3 hours, depending on the severity or the critical nature of what's being requested. So I want to make a personal apology, and so does, I'm sure, our board of directors, that if anyone has ever reached out and has not gotten a timely response in the past year, we are very sorry, but please be a dog with a bone, and we will be there for you. But sometimes it's this happens in volunteer work.
And this question is for Sergeant Gordon. When an individual is identified suicidal, what is Virginia Beach Police Department protocol? And let's say there was a car accident and the person is deemed suicidal. What is the protocol?
So with any type of call for service that involves a suicidal subject, we are going to broadcast that. So Virginia Beach Emergency Services, or 911 dispatch, broadcasts all CIT calls over the air. So there's a tone that goes out, and it's broadcasted of what the call is and that it is in fact CIT related. That then lets all of the officers know that's in that precinct what's going on. If there is a mobile co-responder team working, they will start heading that way. If there is a supplemental CIT unit working, they will head that way. If there's a CIT officer that's working, they should head that way. So really, we want to put the right people in the right places. Our CIT officers don't, although we are separated into different precincts, if there's not a CIT officer available in a particular precinct, they're allowed to cross boundaries and go to that call. We want to put the right person in the right place for that call for service. And through our CIT training, we teach them they have all the time in the world to try to de-escalate the situation and take as much time as they need to resolve it and get the individual to the appropriate services that they need.
And then all of your officers have at least, patrol officers have at least a baseline CIT training.
So correct. We have, we implemented mental health first aid in our academy, which is a one-day training of basically mental health awareness and what it is and how to recognize it. We also have had multiple in-service classes to cover mental health first aid and CIT-related courses. And then we also have a CIT 40 class that we teach 4 times a year, which is the full 40-hour class, which is a volunteer-based class based after the Memphis model, which created CIT.
Thank you. Are there any plans to bring the CIT program to the region as a whole, and what would be the setback? And let me do another one so that we can take care of a few questions here. And what needs to be done to have a Mental Health of America presence in the 757?
Okay, so for the first question, CIT is available in all of the cities. Just each city runs their CIT program a little bit differently. There's no one set way to run a CIT program. Again, with Virginia Beach, we try to take as much proactive approach as we can and be ahead of the curve. And we also welcome in other jurisdictions to kind of help them with their programs. We've helped numerous jurisdictions get theirs started and develop their CIT programs so they're able to implement and get them rolling in their area. And the second question again?
Let me see. What needs to be done to have a Mental Health of America presence in the 757? Thank you.
So I wish we had Mental Health America in 757 as well. That's another volunteer organization that's dedicated just to mental health. Right now, the only resources are online. Unfortunately, the office in Roanoke, I believe, did have to, is it still in Richmond? There was only one, Roanoke had to fold, where they're out of, I think. So unfortunately, there isn't really a presence in Virginia at all at this point because of that lack of activity with volunteers.
Thank you. The next question. Why do patients need to be handcuffed like criminals behind their back when they are being transported to an open bed, sometimes 2 hours?
So every case is handled a little bit differently. I would say that obviously when you're dealing with individuals that are in crisis, at times they can be combative, and we understand that it's not necessarily towards us, but just with what they're dealing with. So for the safety of the officers and the individual themselves, at times they are handcuffed for the transportation piece. And then obviously once we get to the CIT Assessment Center or the hospital, then oftentimes those restraints are removed. But a lot of that is going to be determined and dictated by the individual's behavior at the time of the incident. And again, it's for the safety of the individual as well as the officers involved.
Thank you.
Can you tell me how much of a percentage of that goes towards people on the autism spectrum versus mental illness?
It is, and we do cover that. We have a area during one of our days of training that covers our REACH program, which specializes in autism, and the services that they provide. We actually have a presenter from that company that comes and presents and hands out all kinds of service pamphlets, things that are available, how to contact them, how to really get them involved in the process or services that they provide as well. And they also we educate our officers that they don't only just provide the services to the individual that is living with autism, but also the family members, and training of the family members on how to deal and how to create coping mechanisms for those with autism. The Virginia Beach Police Department also did a in-service class this year for our entire police department, or I'm sorry, it was last year, for our entire police department that covered that subject as well. Yes, ma'am.
Thank you. Again, another question from CIT, so keep the phone. Yes, it says, why is CIT not mandatory for all? Yes?
Thank you, and I'll make sure my voice carries. First of all, I'd like to thank you so much for your initiatives. I'd like to thank Chief Rivera for being an initiative that's important to him. I've been in Virginia Beach since 2013. Shortly after moving here, I was hospitalized. It was a traumatic experience from when you arrived on scene until I made it to a hospital scared for my life. Since then, I've been hospitalized after that, and I've had a much more positive experience. So I have seen improvements, and I will say, after living in Chesterfield County, Virginia Beach is unprecedented in Virginia, in my opinion, and I'm very appreciative of your services. I do want to know if it would be possible for you as a liaison between yourself, myself, and Chief Sabera, who I'd like to meet with soon. Would you consider mandating all officers receive the more comprehensive 40-hour CIT training within a year or maybe 18 months of their graduating from the academy? I believe it should be mandated that they have the comprehensive program, not the baseline.
Thank you. That was the question.
So there's a lot of agencies out there that do mandate it. Memphis was the one that created the CIT program, and we try to stick to that Memphis model, which is a volunteer-based program. I can tell you that the CIT and CIT-related calls for service are important to the department, as well as Chief Severa, as you alluded to. We have gone a step further to not just, over half of our patrol force is CIT 40 trained, but we've taken a step forward to mandate certain specialties that are out there: crisis negotiation, SWAT team, school resource officers. Certain positions like that are mandated to have the CIT 40 training in order to get into those specialties. So we've expanded it, but we're not at the point where we're forcing people to go through the CIT 40 class. As you will hear from NAMI and some of the other folks that are involved in that the CIT, it's a special skill set that. Correct.
Everyone has, even if they are proficient at enforcing the law.
Correct.
I respect your answer, and I appreciate your time. I'd also like to identify each of you by the end of the night. Thank you for being here.
I just wanted to add on the CIT, there are some forces that it is mandatory, and there is a significant difference looking at an officer who was mandated to do CIT versus an officer that voluntarily said, yes, I want this training. You don't want it to be mandated. You want them to get the baseline help, but that's why Virginia Beach is ahead, and why the chief has this foresight into making a really successful CIT program. That's why a clinician is riding today with an officer.
When did that become protocol? I've never experienced that long crisis over 5 times.
It just happened.
So November of last year is when we implemented the co-responder team.
And then where is the CIT assessment center? I had a crisis and was TDO'd at the beginning of this year.
Okay. So the CIT Assessment Center is located at Virginia Beach Psychiatric Hospital.
It won't take you unless you are threatening to kill someone in front of them.
So,
Have insurance.
so it's not about what Virginia Beach Psych accepts or doesn't accept. They have nothing to do with the CIT Assessment Center other than the partnership to allow us to operate in their building. That was in 2010. So now there's different reasons that people would be taken to different locations. So based on the individual and their crisis that's occurring at the time, if they need medical treatment, sometimes we have to go directly to the hospital, and we do not get to go to the CIT Assessment Center. Once they go to the CIT assessment center is where the evaluation occurs, and then that's where they'll conduct their bed search and things of that nature. So they may stay at Virginia Beach Psych, or they may go to Maryview, or they may go to the state hospital.
Thank you, Sergeant. We're going to have to ask for any more questions. You can address the sergeant at the end because we need to answer other people's questions as well. For Annette, how does the public defender office decide to refer cases to you? And how much does your office charge?
As far as the charging goes, that's just simply done by the state. So it depends on, excuse me, it depends on whether or not you meet, how much you make. And once the judge decides that you meet the criteria for having a public defender, I don't quite frankly know what the costs are. That's not something I ever really bother with. As to my getting the cases, when I first started, I got involved with Tommy Cubine's family advocacy group and enjoyed being as part of that group. And they started just assigning me every single mental case that walked in the door. And so I learned how to handle them. I learned the resources out there. I learned how to do the orders. When I screwed the orders up, the hospital generally told me that and said, here's the order you should have done, and go for it. And so I was able to learn when I messed things up how to fix them. And from that part of it, essentially, got more and more into it as the years went by, and tried to help folks more and more as the years went by. And one of the things I would note is that everyone, the Commonwealth Attorney's Office, our office, everyone's involved in trying to do what they can for these folks and get them out as soon as possible, because we're all aware if we can get them medicated and get them out of the jails, it helps the jail, it helps the Commonwealth attorneys, it helps us, it helps the community, and it just sets them all on the right path.
And this question is for Janet. Do you plan to do another documentary related to mental health, mental illness? And what did you learn doing the documentary?
I don't know if I'm going to do another documentary, but I will certainly do some follow-up stories, maybe long-form stories. There's so many different issues related to mental health and things that I learned. It always bothers me when I can't go longer, when I don't get more time and I'm not able to include longer sound bites and more stories. So I definitely plan on doing some follow-up. And I think in terms of what I learned is that it doesn't go away. It's something where, you know, there are some resources, you might get help, you might get stable, but it's something that for families dealing with this, it's really tough on the families. It's really tough on the caretakers. And I saw that. I saw that in talking with Sherita. I saw that in talking with the Yoroskis. I mean, you could just see the look in their eye, you know, just how much concern they have, where, you know, things in this moment might be okay, but I'm not quite sure about tomorrow, you know. And so that was something that really resonated with me.
Thank you. And I'm going to invite the Virginia Beach Human Rights Commission chair, because I have two questions related to our commission. When a complaint is submitted on behalf of a person that is not able to make a complaint themselves, what prevents the Human Rights or department from talking to the person who submitted the complaint? And then the other one, let me start with this one. Do the Virginia Beach Human Rights Commission work hand in hand in the Office of Human Rights when a person's rights have been violated?
The answer is yes. And both of those questions, we serve as a intake but a referral service. So we would, of course, refer our complaint to the experts. Is that good?
Yes, that is good. And I think we are almost at the end, and we're running out of time, unfortunately. But let me tell you, because I have here two very important questions from two people that are here in our midst. And one didn't complete a question, but the person states, I need help with taking medications regularly, and that's all that it says. But I invite you, that is the reason why we have this very important forum. At the very end, this doesn't, end right here. We invite all of you to look, if you have a complaint regarding human rights, we have a desk over there so people can come and share your concerns there. We always refer whatever cases we get to the proper department so that you can get the support that you need. And then another person over here is stating that they have a problem with a neighbor, and they have social anxiety disorder, and they have a glaucoma, and and something about homeless. So somebody evidently needs help, and I'm going to put these two right at the desk for the Human Rights Commission. Please come and identify yourself so that they can have your name and phone number. In that manner, you can provide the resources that will help. And it is time to basically wrap up our program, but not without giving you the opportunity to we thank you, first of all, for bringing all the resources, the knowledge. Thank you very much for being here. But I know that you need partners in our community. And this is a chance for you to dream and see how is it that we as a community can strengthen your work. So do that. And some people here says, what can ordinary but caring citizens do to promote what mental health in our community and how we can get better? I think that's a perfect question.
So I'll speak from the police side. We would like to envision, what one of you had mentioned and asked about is that one centralized location that everybody can receive the services they need. This mental health and the mental health awareness and tearing down the stigma of mental health is a team effort, and it's not just on the police or the public defender's office or NAMI. I mean, we all have to partner together to do this. They need you, we need awareness, we need that voice being spread, and in order to provide the amount of services that are needed for this area, we really truly need you and everybody up here as a partnership and as a team.
And that is essentially it, because we've learned that with dealing with the police, the Commonwealth Attorney's Office, the Department of Human Services, with NAMI, with all the different resources out there, with trying to get the medication components involved, with people having access to housing and services, with discharge planning that the jail is involved with. And our jail in Virginia Beach has been extremely proactive in being involved with trying to give services out. They try to determine, there's an assessment now as people come in and are arrested to find out just who is purely mentally ill, needs access to services immediately. They try to funnel them in the right direction. So I think we are heading in the right direction. Are we there yet? Of course not, but I think we are at least on the right road.
I totally agree with Annette. I think we're moving in the right direction. I know we've had some major initiatives from the state regarding affordable housing for individuals with disabilities and for workforce affordability. When you think about individuals in the city of Virginia Beach, on average, it takes about $21 an hour to afford a modest one-bedroom apartment in Virginia Beach. Compound that with a serious mental illness, and it even gets more complicated to find safe, affordable housing. So I think awareness and continued advocacy is what we need to partner.
And I'll leave my comments to one of my counterparts who's going to ask you all to take just one step of action.
Thank you. And Janet?
I would say awareness, and I think that's where I come in and Channel 13. I know that we hear this all the time as people in the media, you know, they say, oh, it's always negative news, the fires, the murders, and yeah, you do see a lot of that, yes, unfortunately. However, Channel 13 works hard to do better storytelling. There are a lot of local news stations that would never, ever allow you the time to do a documentary because they're interested in filling the 5 o'clock news on that day. So, and you're running out and you have a minute and a half to get a story, you know, to get your story in. And you see that a lot in local news, but we have an opportunity, and I'm fortunate to be able to go to my supervisor and say, hey, I want to tackle this, I want to tackle that. And generally he says, have at it. So I look forward to doing more about mental health and in the mental health community.
Thank you. And I'm going to use that applause so you can help me welcome Max A. Wiley, Advocacy Chair for NAMI Coastal. Max Wiley graduated from Old Dominion University, Norfolk. He obtained his MS in Operations Research from Naval Postgraduate School, and his work experience includes, but are not limited to, having led large military exercises. And he is here precisely to invite us to join advocacy for mental health services. This is extremely important in one way in which we all, not just the people that dedicate their time and lives, but they need the support of the community. And so, Max, the phone is yours.
Thank you so much, Andrea. Just remember that 1 degree of change can cause ice to melt into water. One kind act of an individual can cause someone to save another person's life. STEP Virginia is one of those situations where one action in the course of 9 steps can cause Virginia to have the most world-renowned mental health advocacy and care that there is. You can be part of STEP Virginia. All of you all should have received, when you came in, a little handout about STEP Virginia. Started back with President Kennedy in 1963, said we need to deinstitutionalize mental health. We need to get folks the treatment they need. We need to get it back to community-based. That was President Kennedy 56 years ago. This past Saturday, I watched his daughter, Caroline Kennedy, christened the next USS John F. Kennedy to continue with the legacy of her father. We cannot let President Kennedy down, nor can we let down our loved ones suffering and living with mental health. So I'm going to ask you all a few questions, and I would like your participation with 2 things: by raising your hand and saying the word yes if you agree to these 2 questions that I'm about to pose in just a minute. STEP Virginia talks about getting support for same-day access, primary screening, psychiatric rehabilitation, the services that our veterans desperately need, mobile crisis care, all the things that our panel talked about. These are the same services that are on parity with pediatric, adolescent, adult, and geriatric care. Why should it be any different for mental health? Should it be? No, not at all. So we are asking our Virginia Assembly for this year, 2020 and 21, to fully fund STEP. There's been partial funding over the last few years, but we really need the outpatient services and the crisis services fully funded. All right, so are you guys ready for your questions now?
Yes.
All right, so first one. Should the Virginia Assembly, General Assembly, fund these 9 core services?
Yes.
Yes, all right. Next one. Do you want to better see mental health care locally in and around our state?
Yes.
All right. Are you willing to advocate with us fully to see differences with our state?
Yes.
Now, Since you've raised your hand 3 times, that means you are willing to go out in the vestibule and sign your name up so we can contact you, so you can be an advocate. Uh-oh, now you're trying to say, I don't know what advocate means. Yes, you do. Advocate means you have a passion for what you believe in. To be able to talk to someone about mental health, to be able to allow them to listen to your story, to look at them in the face and get 2 shakes, a hand this way and a hand going the other way for agreement. So start locally. Text your local congressman, text your mayor. Mayor Bobby Dyer is phenomenal. He really wants to help get some things through along with our governor. Text, tweet, email, walk up to them, have an appointment, start local, start at the state level, and eventually we can get to the national level. So we need everyone to sign up tonight. We need everyone to visit our tables, and we need everyone to make a change for STEP Virginia. Are we ready to do that? Yeah. All right, let's go. Here we go.
Hey, what an energetic way to end our forum. But before that, let me ask you to please join us for a little celebration out there. We have some refreshments, but we want to thank the following organizations that are out there waiting for you to come and visit. We have Kath Sievert with NAMI, Brian Preston Orders Home Program, a merger between Veteran Affairs and Western Tidewater Community Services Board, Michelle Peterson with Sarah Michelle Peterson Foundation, Shelby Gills with Virginia Beach Department of Human Services, Courtney Pitt with Milestone Mental Skill Building Agency, Carrie Pasquarello with EVMS Art Therapy, Paige Huff with Christian Psychotherapy, Yvette Yates with Virginia Beach Strong Center, Kathy Wakefield with I Need a Lighthouse, James Gordon with Virginia Beach Psychiatric Center, and Michelle Lasky with Harbor Point Behavioral Health Center. Thank you to all of those organizations for coming tonight to make this community very proactive. And before you leave, the last thing I want to share with you is the Virginia Beach Human Rights Commission wants to bring this conversation series to all of us. And I invite you to join us. The next event is going to be regarding race, institutional racism, bias, and human rights. That is going to be on Tuesday, March 31st. Mark your calendars. 2020 from 6 to 8:30 p.m. right here, and we are thankful to MOCA for hosting our conversation series. Have a good night, everybody, and enjoy yourselves.